Hello, hello. It's me, Dr. Catherine Toomer. I'm a family medicine and community health physician and founder of Total Weight Care Institute. And thank you for joining. If you're here, say hello. If you're here watching later, say hashtag replay. I'm little if I seem a little discombobulated and everything seems to come out late, I just spent a very wonderful few days in Jamaica. I got my little tan on, and and so one of the things that I thought a lot about, and because of course, you're on a beach, you're wearing a bathing suit, I was with a group of wonderful women, and so and everyone knows that I do weight loss and weight care, and so it came up often, and that's fine because it often does when anyone who does this kind of work, they often get asked a lot of questions. One of the things, though, that is an underlying theme, and I see this all the time, is that advice that has been given in the past often comes off as very judgmental and accusatory. We often tell people, and nothing's wrong with this, that they should eat a certain way, they should move a certain way, and that unless they do those things, they're not really healthy and they're not going to lose weight, or their weight health is not going to be maximized. Now, that is true that, there are many pillars of weight loss, and all of those pillars need to be addressed in order for there to be success. But the underlying success of any process with human beings is that it's a biopsychosocial approach that is maximized also. And what I mean by that is whatever you do has to be biologically sound and healthy, has to be psychologically sound and healthy, as well as socially sound and healthy. And so often when we're giving advice, we're not taking that into consideration. So one of the things that I hear a lot is, should I be eating a plant-based diet? Or I was told I should eat a plant-based diet, and I was told that I should exercise every single day. And there's nothing wrong with that. And it's good that that advice is given. But often what it does is it sets a person up for failure. It doesn't give them any steps on how to do it. It doesn't, it lends itself to extreme behavior. And often when we do anything in extremes, we tend to not be able to maintain it. And when we can't maintain it, then often it does more harm than good. It sets us back to before or beyond where we started. Because what happens if you cannot maintain a process, the next time you try, there's more fear of failing. There's more self accusation. There's more self imposed judgment because of what happened before. And so, when giving advice to anyone, there are three things you need to understand. Will this advice cause, is there anything biological that would make this advice unsound or harmful? So telling people to eat a plant-based diet for the most part is very healthy. But when people's food choices are dependent on an underlying biological process like insulin resistance, driving cravings, driving appetite, or prediabetes, driving cravings, driving appetite, or diabetes, any type of glucose dysregulation, driving cravings, driving appetite, without knowing someone's thyroid function and whether it's been checked and whether they're hypothyroid. And so therefore it lends itself to depression, and therefore depression then changes how someone chooses food, what happens to food in their body. By telling someone eat a plant-based diet without knowing any of those other things is simply setting them up for failure, because none of those things have been addressed first. When offering advice on how someone should do something without knowing what their life is like and how far it is from where their life is presently, essentially is judging their life. That's how it comes off, as a life judgment. And so it's always important that before offering advice, to find out where a person is and meet them there. Socially, when we do a lot of our social things, we do it around food. And so when making changes, if it's going to affect our relationships, it's really important then to do it in such a way so that it's an increment, so it doesn't affect everybody around you. The more a process adversely affects family, friends, work, daily life, the less likely it's going to be maintained. So again, it sets a person up for failure, that psychological pitfall that's set up so that when they try to get back into a healthier process, there's more fear, there's more self-doubt, there's more self-accusation, there's more internalized shaming that occurs. And so it's important that when doing any process, it's in small enough increments so that those increments can be maintained. It is important to measure your success in many ways, not just in the amount of being able to do something or the amount of weight that is lost, but rather how you feel in the process and how well you've taken control. Because if you control it, good or bad, it's still yours and it's your control, and that's going to make you feel better than doing something to the extreme and then failing. And so overall, again, when offering advice, you meet a person where they are. You offer that advice based on increments, that in changes that can be maintained, so that the psychological pitfalls of not being able to maintain it can be avoided. Because as soon as you start giving advice based on things that are so far removed from where a person's life is at the moment, really all it does is set them up for failure, and it immediately sets them up for self-judgment. So again, I'm Dr. Catherine Toomer, and I'm just going to add that when there are underlying issues, biological issues, when you treat those issues, all the other things that can happen, like muscle building, like making certain choices for a plant-based diet, if you feel that that's the healthiest thing to do, it makes it so much easier. So like I say, instead of pushing a boulder up a hill, use whatever tools are at your disposal to pull that boulder up a hill. Once it's there, then you can start making changes or thinking of ways to keep it there, and then remove all the other things that aren't necessary. So if there's nothing wrong with taking medication, it's the most immediate way to prevent damage of any kind, of any process that's happening. And then once you're stable, once your body's back to its reset, then start making those changes that will be so much easier at that point. And once they're easier, you can make them, then go back and start reducing the medication once those changes start taking over and taking hold. So again, I'm Dr. Catherine Toomer, stepping off my soapbox because this is something that has been very, it's come up quite a bit. And what happens often, what I see is that people just give up and then they never try anything else. So again, I'm Dr. Catherine Toomer. If you want more information, if you'd like to work with me, you can just send me a message either here as a DM, or you can contact me through my website, which is monitored by me and my assistant. And there are many, many ways that I can help people. And there's many ways that I do it by meeting you where you are. But of course, it always starts with the free consultation, because I want to make sure that I am able to help you in the ways that you need help. And if I can, I will definitely direct you where you need to go. So again, thank you for joining in, and I'll see you next week for Dr. Toomer Talks on Tuesday. Good night.